Pregnacare Show is proudly brought to you by
Phenomenal Water.
Dole yogurt.
Inability to conceive a child after 1 year of regular unprotected sex by couples is infertility. Infertility is a widespread problem that has emotional, social, and economic impact on the family. Research tells that 40% of the cause is from men, another 40% is from the women. The remaining 20% is unknown, but it's funny how women in our society are blamed for the issues of infertility. About 1 in 4 couples in developing countries are affected by the issue of infertility, which is about 48.5 million couples experience infertility. On today's episode, we will be looking at what infertility is. So on today's episode, we have a gynecologist here with us. He's going to tell us what infertility is and the causes and what are the treatment options available. The show is brought to you by Vena Mineral Drinking Water.
This advert is FDA approved.
Mommy is coming!
Have you cleaned the kitchen? Done all the chores?
Yes, ma'am.
Then it's time for
Dole yogurt. Dole yogurt. Everybody grab Dole. It's delicious, creamy, and refreshing too. Mommies love it, and dads enjoy it, and the children, they love it. Raise a cup, it's Dole yogurt. Raise a cup, it's Dole. Raise a cup, it's Dole yogurt. Raise a cup, it's Dole. Dole yogurt.
This advert is FDA approved.
So on today's episode, we have a gynecologist here with us. He's going to tell us what infertility is and the causes and what are the treatment options available. Doctor, you are welcome to the Pregnacare Show.
Thank you.
We are so grateful to have you on our show today. So for the sake of our viewers, we want to know your name, what you do, and where you work.
Okay, my name is Dr. Eko Adams. I'm a consultant obstetrician gynecologist based at Resolve Medical Services here in Community 18, Tema.
Okay. So doctor, how many years have you been practicing?
Oh, I've been practicing for about 25 years.
Okay. So doctor has been practicing for so many years. If you need any doctor, kindly visit Resolve Medical Center and you would be attended to. So doctor, I want to find out when we talk about infertility, what is infertility, or what could someone describe as being infertile?
Okay, so infertility, we say a couple is infertile when they're desirous of a pregnancy and it hasn't happened for about 12 months of having regular unprotected intercourse.
So what are the causes of infertility?
Well, the problems or the causes of infertility are numerous. For the sake of our program, it's best to divide it into issues that affect the man and issues that affect the woman. Unfortunately, in our culture, we tend to think that if a couple is infertile, it's invariably the woman's fault. But statistics and evidence, scientific, suggest that it's not really the case. In 40% of cases of couples that are trying for a baby, yes, it could be the woman's, I wouldn't say fault. Fault is like intentionally causing the problem. It's issues related to the woman, which we call a female factor. And that accounts for about 40% of cases. And if you think about it, in another 40% of cases, it's the man's issues as well. And the remaining 20%, it's what we call unexplained. It's not really the man on the fault. The pregnancy is just not happening.
Okay, so from your explanation, that is basically equal. So
Yes.
40-40 on each side.
Yes.
So it means that women should not be blamed for the problem of infertility, as doctor is saying.
Yeah.
So doctor, I would want to know, are there any obvious signs that would show if a person is prone to becoming infertile, probably as we are growing? Are there any signs that might tell me that, oh, as I'm growing, I might be infertile?
Okay, so there are no physical signs per se to suggest that a couple could be infertile. But there are other factors that will probably contribute to your risk of having challenges when it comes to being fertile. And then the number one cause for a woman is probably your age.
Okay.
Because it is a well-known scientific fact that the number of eggs a woman has rapidly diminishes with age. So for women, the number one cause is your age. So if you're desirous of fertility, it's advisable that you don't leave it too long. Certainly with the modern woman, because of career and other stuff, body image and things, you tend to delay your attempt at fertility for a number of years. But it's not advisable. It is used to say that the best time to try for a baby is probably between the ages of 21, 24 for your first baby. And so advisedly, don't leave it till well in your 30s before you try for a baby. There are other sub-factors as well. A history of pelvic infections, which could compromise the functionality of your tubes, could be important. Because any pelvic infection that is not treated properly can lead to tubal blockages. Okay. The other conditions, gynecological conditions as well, called endometriosis, that causes irritation, that leads to scar formation inside the pelvis, which could obviously entangle the tubes and lead to problems with the patency. Other benign conditions are fibroids. We know fibroids are very common occurrences with women, especially in this part of the world. We have different types of fibroid, and depending on the location of the fibroids, especially those prominent ones that sit within the cavity of the womb, they can reduce the chances of the embryo implanting. So in this case, that can lead to challenges as well.
A woman diagnosed of having polycystic ovarian cyst, is she at a risk of infertility?
Potentially she could be, because PCOS, or polycystic ovarian syndrome, it's an endocrinological order which affects the woman's ability to regularly ovulate, which means produce eggs on a regular monthly basis. So this is another clinical condition that can lead to fertility challenges.
Could you also help us know some of the signs or some of the problems that might cause infertility in males as well, since you've given us what the females want?
Okay, so like I said, 40% of couples, it's a male factor, and the leading cause is if the man has problems producing sperms, and the causes can be varied. It can start from in his infancy. I'm thinking of a condition called mumps, childhood infection.
Okay.
Sometimes, unfortunately, it can affect the testes, which we call mumps or myocarditis. And if that happens, it can affect the man's ability to produce sperms. Surgery during infancy. Some men are born with conditions that prevents the testes from descending, undescended testes. And sometimes that can lead to problems with sperm production as well.
What of low sperm counts? Something like that. And you also have cases where a man actually does not produce sperm.
Yes, azoospermia we call it. That's the clinical term. Yes. Like I said, one of the causes of this could be childhood mump infections that affect the testes. Surgery in the groin testicular area can affect it. Chronic illnesses that affect the man's general well-being can affect the ability to produce sperms. So the causes are numerous and varied. So basically, any couple, in my clinic, any couple or woman coming for fertility challenge, I wouldn't consult you until you come with your husband or male partner. Because like we deciphered, almost half the amount of cases that come, it's not the woman's fault. So we do all series of investigations to find out, including semen analysis, to find whether the man has issues with sperm production or potency of the sperms.
But I would want to know, do they have types of infertility, or it's just infertility?
For clinical purposes, infertility or fertility challenges is classified as primary when the couple have never been pregnant,
Okay.
despite years of trying, and as well as secondary. It means the pregnancy has happened before, but subsequently, consequentially, the pregnancy is not happening for whatever reasons. So those are the two main distinctions, either primary or
secondary.
So
would you advise that probably in our reproductive ages, or when we are preparing to marry, it's okay to have this reproductive screening so that in case there are any problems of reproduction, could be treated early before we get married or something like that?
That is a good question, but for practical purposes, it's very difficult. Okay. Because a lot of the tests we do are quite invasive and time consuming, not to talk of the financial constraints. So for the purposes of practicality, we assume every couple should be able to fall pregnant unless you've tried for a year. These days, we're even pushing the limits up to 18 months. Okay. And that we don't put, couples through the unnecessary rigmarole of investigations and, being prodded and poked about.
So, doctor, are there any physical things we do that might also contribute to us becoming infertile? Maybe eating something or something, any physical thing that we as individuals could have done that might prone us to being infertile later in the future? Of
course, the general thing is looking after our bodies properly. So general health and well-being is very important. Okay. Because we do know that if you're unfit, it could lead to secondary problems that could culminate in fertility challenges as well. For a woman, obviously, we do know that your risk of having problems increases with age, physical size. I'm talking of obesity. Okay, obesity is a contributing factor to a lot of problems, as well as general hygiene and reproductive wellness. This include obviously lifestyle, okay, reducing your number of sexual encounters, protection against infections that could potentially cause pelvic inflammatory diseases that could lead to tubal problems later on. So these are some of the things that we advise, as well as with the man, obviously, eating well, exercising, avoiding alcohol, smoking. These are all things that can affect the quality of one's sperms.
Okay. So doctor is saying that it is important for us to live healthy and exercise so that you don't also prone yourselves to infertility issues later in life. We'll go for a short commercial break. When we come back, doctor will tell us more about infertility treatments and options, and we will hit the streets to find out what our viewers have for us on today's episode.
This advert is FDA approved.
Mommy is coming! Mommy is coming!
Have you cleaned the kitchen? Done all the chores?
Yes, ma'am.
Then it's time for
Dole yogurt. Dole yogurt. Everybody grab Dole. It's delicious, creamy, and refreshing too. Mommies love it, and dads enjoy it, and the children, they love it. With a cup is Dole yogurt. With a cup is Dole. With a cup is Dole yogurt. With a cup is Dole. Dole yogurt.
This advert is FDA approved.
This show is brought to you by Vernal Mineral Drinking Water. Let's hit the streets to find out what our viewers have for us on today's topic.
My name is Stella Adote. I want to ask the doctor why infertility treatment is so expensive in Ghana. And I want to ask him, if you swallow a sperm, will you get pregnant by swallowing it?
Me and my partner are suffering from infertility,
we have no idea where the problem is coming from. What do you recommend us to do?
Hi, my name is Henrietta. I wanted to find out what prevents a woman from getting pregnant again after 5 years. Is that also an infertility? The men involvement in infertility, are they also supposed to take medications like the way women also take?
So those were some questions from our viewers. Doctor, a viewer just asked, she wants to find out why is it so expensive in treating infertility? Because she is saying when she got married after 2 years, they weren't able to conceive. So they tried a fertility center, but it was quite expensive and they couldn't afford the treatment. So what makes treatment expensive?
Unfortunately, in this part of the world, fertility treatment can be quite financially tasking. And it's basically because of the amount of investigations one has to do. You know, sometimes the drugs one has to sort of give the couple to try and either improve the amount of eggs that are potentially produced or to improve the quality of sperms. So these are all economic factors that can be quite challenging. Yes.
So from what you said earlier on, and even from what the viewer asked, that means there are treatment options.
There are treatment options.
So what are the treatment options?
Well, the treatment options can be numerous and varied. Okay. Depending on what the cause is. If, for example, the woman, we find out that she's suffering from polycystic ovarian syndrome, which means she's not regularly producing eggs. So the treatment option can be tailored to this particular woman, but advising her again, lifestyle, eating well, losing weight, to giving drugs that potentially could stimulate ovulation or egg production. Okay, and this goes from cheaper options to quite expensive options. I'm talking of the clomiphene citrates, which we give orally, to more potent drugs like follicle stimulating hormone or other hormone-based drugs we use to stimulate the woman to produce eggs. And this unfortunately could be quite expensive.
So doctor, what would you say the effect of infertility could be on marriages? Do you think it's that easy with them? Because I'm asking this because, as you said earlier, most women are being blamed for the issue of infertility. So they go through a lot. Some, even at the expense of treating this, might even cause themselves more infection. Yes. I have the case where the woman was infertile. She was having problems and pressure from the external family. So she tried some herbal medicine, and she later passed on, which was so sad. So what could the effect be on families?
Yeah, that's simple answer. It could be devastating. I mean, I've known couples who've ended up in divorce because of these things. Basically, I think the main thing one has to do is educate the general public. Education in the general public, obviously we have certain social-cultural phenomena which don't help. Like invariably in this part of the world, if a couple don't have children, they tend to blame the woman. But like I said, if you have an understanding and training these things, you understand that it's a mutual problem. It's not really the woman's fault. Okay, what if we investigate and we find out it's the man's fault? Then we start blaming the man, we're checking out of the relationship. So basically we just have to educate. Education, education, education.
Okay, so we want to know, what is IVF, what is IUI, and surrogacy? Because I know they are all treatment options for infertility. Yes, so we want to know what differences those.
It's entirely different games you're talking about.
Okay.
When we say IUI, which means intrauterine insemination, in this case it means we ask the man to produce sperms in our lab, we enrich it basically, and then we introduce it into the woman at a particular time in the cycle, which is more like when she's more likely to conceive. So in a case like this, we obviously would have run a test to see that the woman's tubes are patent. Okay? You don't offer IUI to somebody whose tubes are blocked. So if you've done your test, a tubal patency test, and you find that the woman's tubes are blocked, you don't offer her intrauterine insemination because there's no communication between the uterus and the eggs and the ovaries, where the eggs are coming from. So it's a wasted procedure. In a woman like this, you're either looking at IVF, that is where we take the sperm and we take the egg and the laboratory conditions, we put them together. If it takes, then you implant it in the woman.
Okay, so that is done externally.
That is an external procedure. It's a laboratory procedure, a specialized laboratory procedure. You need a laboratory that is well equipped. You don't run it at any clinic. Okay? You need a specialist embryologist.
Okay.
Okay, so it's not even a doctor who does these things. The main guy here is an embryologist. So the doctor will give the eggs, the drugs to harvest the eggs.
Okay.
They give the eggs and the sperm to the embryologist, works on it, looks at it consequentially in his lab to see whether it's fertilized and it's growing well before he harvests it and gives it to the gynecologist to implant it in the woman.
Does it work for everybody?
Unfortunately, no.
Wow.
In the best centers, especially worldwide, you find that the take-home baby rate. And when I say take-home baby rate, it's not just the lab producing the thing and say it's worked.
Okay.
You have to look at what is called the take-home. That after all this, what is the end result? The end result is the mother or the couple taking their baby home. And you find that in the best centers, you find that it's only 30 out of 100 couple that, and this is the best center. So if you have to get 30 or 40 out of every 100 couple that come for treatment, it means your hospital or center is good. So unfortunately, it's not 100%, even in the best centers.
Oh, okay. I read somewhere that IVF mostly comes out with twin pregnancy or twin gestation. How true is that?
That is a good question. In the beginning, when they were doing a lot of fertility challenge, don't forget IVF started in the 70s. I don't know if you remember. The first case was successful IVF was in Britain, Louis Brown. Yes. In the initial stages, to improve your chances, they were tending to implant a lot of the embryos, 2, 3, but research has shown that to be able for the pregnancy to succeed, this time we're even going from implanting 2, which used to be the norm, to now implanting even 1.
Okay. Because
evidence has suggested that if you implant 1 at a better stage in the embryo development, it's better than putting 2. So these days, most best centers will implant, it's called the blastocyst stage, to implant it at that stage of the embryo's development to make it more successful.
So what's the, with surrogacy, what is it about?
Surrogacy,
which people can go in for that?
Surrogacy is a different ball game. A surrogate means there's somebody standing in for something. Okay? So a surrogate is a young woman, let's say an infertile couple, which would try and use a surrogate when the woman is probably a bit on the older side, let's say over 40, to improve the chances of the pregnancy carrying to term. So a surrogate is basically using a standing younger woman to carry the pregnancy.
Okay. So couples with infertility issues, could they also go in for adoption? Do you think that is also a better way in resolving their child issues?
Personally, I think so. But unfortunately, in this part of the world, it's not something that, again, socio-culturally, they tend to look favorably towards. But I personally advocate for it. Because if, let's say, in this part of the world, IVF is going to set you back about 40, 50,000 with no take-home guarantee that it's going to work. And I subscribe to that school of thought that, look, being a parent is not just a biological function, okay? There's more to it. It's nurturing and giving the child the best opportunity in life. So why not look at adoption? In my clinic, I tend to encourage or have that discussion about how the couple will feel about adopting a child that needs, love and care in a better environment. You can raise the child in your own image, okay? It doesn't necessarily carry your genes, but like I said, being a parent is not just a biological function. So I personally advocate, yes, adoption.
So being a parent is not just a biological function. So if you're having problems with infertility in your marriage, you could seek for all other treatments. Probably need to go through a series of screenings and labs to know what actually is wrong with you so that you do not go in for the wrong treatment. Let's go for a quick commercial break.
This advert is FDA approved.
Mommy is coming! Mommy is coming!
Have you cleaned the kitchen? Done all the chores?
Yes, ma'am.
Then it's time for
Dole yogurt, Dole yogurt. Everybody, grab Dole. It's delicious, creamy, and refreshing too. Mommies love it, and dads enjoy it, and the children, they love it. With a cup is Dole yogurt, with a cup is Dole, with a cup is Dole yogurt, with a cup is Dole yogurt.
This advert is FDA approved.
The show is brought to you by Vena Mineral Drinking Water. Doctor, please, we would want to take a final word from you. What do you have for our viewers at home, those watching us? What do you want them to know about the issues of infertility?
Okay, so what I'll say, my take-home message is, yes, fertility challenges can be quite devastating for the couple. You don't really have to sit at home and play a blame game, if you understand. You're blaming the woman, you're blaming the man. I would advise that if after a year of actively trying for a baby, and when we say actively trying, it's 2-3 times a week of unprotected intercourse on a regular basis. If a pregnancy doesn't ensue after a year of trying, then I advise that you come see a specialist gynecologist. As a couple, the man doesn't just send the woman, or the woman takes it upon herself that she's the cause of the problem, so she's going to see the doctor to find out whether she has any issues. It's a couple issue, and I advise that you come see the specialist to try and get to the bottom of it and hopefully give you answers. Because the reasons can be, like I said, numerous and varied. So it's only a series of tests that will point you in which direction that potentially you need help on.
So seek help if you need one about your infertility issues. Our tip for this episode is, as partners preparing to marry, try as much as possible to visit your gynae so that you are being screened for different reproductive reasons, or you go through a series of examinations that might detect any condition so that it's treated early and then this does not resolve into any later complications. So let's try as much as possible to visit the hospitals, do our reproductive screenings and labs so that we are safe at each side. And as well, couples trying to have babies or couples dealing with infertility issues should see their gynaes. Probably it's just a minimal issue. Take your time, see your gynae, go in pair or go as couples. One person should not go and see the doctor. That your doctor will not even attend to you. So let's try as much as possible to go as couples to see our doctors and get treated for infertility. And this is to all viewers. Do not push couples who have not had a child yet. Give them time and they will bring forth a bouncing baby. Thank you for watching today's episode. This show was brought to you by Vena Mineral Drinking Water and supported by Unicorn Pharmaceutical. The show is the Pregnacare Show and my name is Dede. Kindly do well to follow us on all our social media handles at the Pregnacare Show and subscribe to our YouTube channels. See you next week for a more interesting episode.